So the one thing I will start with is if a child needs braces, they have a neurofacial myofunctional disorder. So every single child who needs any sort of expansion or braces because their teeth are not straight or their teeth are not coming in, and I'm not the dentist, right? So I don't teeth for a living. We deal with the muscles that can influence teeth. But I see a lot of missed opportunities here because expansion without therapy is incomplete. And therapy without addressing structure can also only go so far, right? It works both ways. And so people will say to me, well, what comes first? Like the chicken or the egg? Like, what do I do first? Honestly, it depends on the case. And, you know, yeah, I mean, I think it's like one of those things
I'm
where
applauding that.
yeah, I'm like, who's sitting in front of you? Like, what is the kid? How much expansion do they need? Can they get their tongue up there right now? Can we start therapy and fairly expect the child to make some progress? Or are we asking them to work against a system that's working against them, right? And not working with them. So in some cases, we've recommended the kids start with expansion and then we start working with them. In some other cases, we've started working with the kid and then expansion is part of that journey. Maybe it's not immediate, maybe it's coming soon. It really depends. And how severe are their symptoms and how much is it impacting their daily life? And what is the parent's plan for them? Because at the end of the day, that dictates what we do in therapy. As much as we as therapists, clinicians, doctors, like as much as we want certain things for our patients, the parent is part of that evidence-based triangle, right? Like their experience, their goals is just as important as the research that we're looking at, as our clinical experience. And so we have to kind of like integrate all of that together to figure out like, well, what is this kid's journey going to look like? And listen, if a parent's like, I'm not doing expansion or I'm not having a tongue tie release or I'm not doing, okay, that's their choice. But we also have to have a conversation about, well, if and when we hit a wall and we can't make further progress, it might look like this. I don't have a crystal ball. I don't know, but I like to have those conversations up front for families that are kind of on the fence or like, absolute no, not doing X, Y, or Z, so that they know we're not just going to keep you in therapy indefinitely if you're not doing what we think is, if we hit a wall and we feel like we can't make more progress, right? And I think it's a very fair conversation to have. And I will tell you, 98% of parents at that point that you hit that wall go, okay, we're ready now. Like what is it do you think is the next step? Who else should we talk to? Because you've built the rapport and you've built the trust and they see their kid is making progress, but now they see their kid is struggling again. Right. And so I think it's all part of the human experience that sometimes we have to let people experience things their own way. And we can't just continuously dump education and our therapeutic treatment on them, just because that's what textbook should look like. But anyways, on the flip side, kind of going back to some of this when I mentioned, if you expand the palate, right, and don't retrain the tongue or breathing patterns, muscle function, right, the body's just going to fall back into old habits. And then we see that orthodontic relapse, which is so
Just like you experienced. Yes.
I've experienced as,
Yeah.
yeah, I patients come to us that have already experienced it. We primarily focus in pediatrics, but also in my private practice, we do see some adults. So we've seen the whole lifespan, right? Just for Myo specifically. And I've had it come to me and say, I don't want an appliance. I don't want a tongue tie release. I just don't want to be in as much pain. Can you help me? Okay, sure. We can give you some exercises. We can work together to see if we can relax your muscles, teach you some things to do when you're in a certain, you wake up a certain way to help release things. And if that's your goal for yourself, then yes, we can help you with that. Um, Anyways, on the flip side, right, if you're doing therapy, the child physically doesn't have the space, as I was mentioning, for like proper tongue posture. You can't ask them to suction their tongue and expect that tongue's going to live up there, right? You're fighting an uphill battle. So the magic truly happens when both are done together. Like that is where we see that like real lasting change. But again, I go back to we have to also respect the parents' wishes and for their children.